Welcome for dentist and by dentist. We are here today to answer one of the many questions in our series of top asked questions by dentists here in the US. Today, our guest is Dr. Steven Davidowich, also known as Dr. D. He's the co-founder at Monmouth Clear Aligners and the owner and practicing dentist at Luxury Dentistry in New York City. He received his degree from New York University College of Dentistry, also trained in implant surgery and restorative implant dentistry from New York University, and is a fellow in the International Congress of Oral Implantologists. Dr. Steven, or Dr. D, practices general and cosmetic dentistry with a true love for smile makeovers through his clear aligners and porcelain veneer treatments. He's an active member of the AACO, the ADA, the AGD, and the AAFE. He's authored 2 books to educate the public, and his most recent book, The Power of Transformation: How Changing Your Smile Can Change Your Life. His new TV show, Your Best Self TV with Dr. D, is about transforming your life. Please welcome Dr. D.
When I started doing clear aligners, it was before there was digital scanners. So I would be taking PVS impressions and I would pour up the model myself, and then I would suck down plastics. Now, this was not the way to do things. The cases took forever, and it was only for really mild cases. We are now using plastics to do anything, right? Pretty much. Obviously, I don't take on cases that are going to waste my time and chair time, so I refer those cases. But for the cases that could be treated in my office where I'm profitable, I am using the clear aligners, but in the right way, because in today's world, digital impressions are so much more accurate than the traditional analog impressions. So when I founded the company Monmouth, we did take, because I was an expert in taking these impressions, I actually taught how to take these impressions at school. It's hard. It's hard to capture every single tooth in the mouth and get really accurate impressions, because it's not just for a single tooth crown. We're talking about every single tooth and all the gingival aspects to really capture that. Digital impressions has made that so easy to capture that for the dentist, and also makes it easy to manufacture aligners that are going to fit and work. Therefore, at this time, Monmouth is only accepting digital impressions. But for those dentists that are like, the investment on that is just too high, we have some exciting news on that.
Do tell. I'd love to hear what that exciting news is. I'm sure
Yeah,
we have a lot of listeners out there that want to know.
So you ready for this? Monmouth is willing to loan out a digital impression system to offices that are wanting to bring in clear aligners to their practice. They're going to use Monmouth. You could call us. We're so happy to welcome you to the Monmouth family. We'll go through the terms. It's very simple terms, and we can get you rolling. And you can really see what power of bringing Monmouth clear aligners into your general practice is going to do for you.
Wow, that's an incredible offer. I wish I was a dentist. I could take you up on that.
It's an expensive piece of machinery, but we're so confident in our product. It's a no-brainer, because if that's the holdback, we'll take care of it. Get the digital impression so you get accuracy, and you also get an amazing product that will be minimal chair time, change your patient's life, and bring in crazy amount of revenue into your practice.
I can only imagine the patient's perception when you pull out the digital scanner versus doing mouth impressions. I know how I would feel sitting in the chair if they had a digital scanner, and you can watch it. From what I can take, you can see what's going on the screen. That's incredible.
So
well, thank you, Dr. D.
I was one of the first, I'm sorry, I was one of the first in New York City to offer digital scanning. It was a totally different world. I don't want to belabor this in the video to get too long, but we used to spray the teeth with powder, and it would make them all glittery. It was very funny times, but it made sense to me, but it wasn't an investment. But it really doesn't just change your practice with the clear aligners. The scanner could also be used for every aspect of restorative dentistry, and Monmouth's not going to hold you back from using that scanner for any other opportunity to make money and get your practice to grow.